Hello everyone, my name is Fu, and today we will be talking about newly developed drugs for our hormonal systems. The endocrine system, which is responsible for the production and regulation of hormones, plays a crucial role in the proper functioning of the human body. Among the various hormones that are produced, sex hormones are particularly noteworthy due to their significant impact on the cells that respond to them. These hormones are integral to a range of physiological processes and are all essential for the maintenance of homeostasis. To commence the discourse, we shall delve into the subject matter of a novel pharmaceutical agent, namely elacestrant. Elacestrant is a type of selective estrogen receptor degrader that is administered orally. Stemline Therapeutics, a subsidiary of the Menarini Group, is presently involved in the creation of elacestrant for breast cancer that it specifically targets the estrogen receptor while sparing the human epidermal growth factor receptor 2. In January 2023, elacestrant received its initial licensure from the United States Food and Drug Administration. The pharmaceutical agent under consideration is intended for the treatment of advanced metastatic breast cancer in postmenopausal women or adult men who exhibit certain characteristics, specifically estrogen receptor positive, human epidermal growth factor receptor 2 negative, or estrogen receptor 1 mutated breast cancer that has advanced after at least one endocrine intervention. The aforementioned development denotes a noteworthy progression in the management of breast cancer. Elacestrant has been found to share a mechanism of action with fulvestrant. The study has shown that elacestrant exhibits the ability to effectively impede the growth of tumors in MCF7 tumor xenografts in vivo, which is in line with the impact of fulvestrant. The administration of elacestrant at a dosage of 30 mg per kilogram was deemed viable and well tolerated in both murine and human subjects. Similar levels of plasma exposure were observed in both groups. The available empirical evidence suggests that there exists a correlation between the effectiveness of a substance that targets the endoplasmic reticulum and the degree of expression of estrogen receptor and progesterone receptor. According to the findings of a clinical trial conducted by Bedard et al. In 2022, the use of elacestrant has resulted in a significant enhancement in progression-free survival in comparison to the standard of care therapy for individuals diagnosed with advanced or metastatic estrogen receptor positive or human epidermal growth factor receptor negative breast cancer in second or third line of treatment. Recent research findings indicate that the use of aromatase inhibitors is associated with an increase in vulnerability to developing cancers that are characterized by estrogen receptor 1 mutations, which are known to be resistant to treatment. Elacestrant has demonstrated the capacity to effectively bind to both the wild type and various mutant forms of estrogen receptor 1. Bahani et al. In 2017 have reported that their findings indicate the potential effectiveness of the treatment for genes other than Y537S. The observation has been made in the domain of breast cancer treatment that tumor cells continue to depend on estrogen receptor signaling for their proliferation, even after the administration of CDK4 or 6 inhibitors. The observation of CDK4/6 inhibitor resistance has been previously documented and has been linked to several factors, including RB loss, CDK6 overexpression, and the upregulation of cyclin E1 and E2F1. Notwithstanding the obstacles, elacestrant has exhibited the capacity to proficiently impede estrogen receptor dependent proliferation. The utilization of hormone backbones in combination therapies, which are strategically designed to combat resistance, is a promising approach. The significance of steroid hormones is not limited to sex hormones alone, as they play a crucial role in maintaining homeostasis within the human body. The next drug we will discuss about are vamorolol and esacerenol, two novel pharmacological agents that exert their therapeutic effects in modulating steroid hormone receptors. Vamorolol has been observed to possess dual functionality in relation to both the glucocorticoid receptor and mineralocorticoid receptor, as per pharmacological analysis. The effect that has been observed pertains to a decrease in inflammation. As per Gardens in 2022 report, this drug exhibits a distinct chemical composition and mode of action compared to traditional corticosteroids. A technology was developed with the objective of augmenting its potential efficacy in the management of Duchenne muscular dystrophy. As per the analysis, this drug is categorized as first-in-class, which implies that it is the primary medicinal compound formulated to treat a particular medical condition. The current investigation presents an analysis of the safety of administering vamorolol to patients diagnosed with the Duchenne muscular dystrophy who are between the ages of 4 and 7 years. Centers did not report any negative impacts that would require a decrease in the medication dosage or termination of the trial. According to their findings, the administration of a dosage of 2.0 mg per kilogram per day exhibited a greater degree of safety in the clinical context when compared to the external controls who received prednisone. The administered dosage resulted in a decrease in weight gain and an improvement in biomarkers associated with bone turnover and insulin resistance in the subjects. In a randomized clinical trial, the results indicate that male individuals suffering from Duchenne muscular dystrophy experience a considerable improvement in motor outcomes. Gardens in 2022, recent research has demonstrated that the use of non-corticosteroid medications can effectively preserve patients' height and alleviate the negative impact on their bone health. The FDA has granted clearance for new drug application for vamorolol, which is developed by Santhera Pharmaceuticals and Dragon Biopharma. This drug exhibited effectiveness in both primary and secondary outcome measures. Over a duration of 24 weeks, a cohort of 121 subjects was monitored, with 94% or 114 individuals successfully concluding the study. The study's results indicate that vamorolol was found to be safer and more easily tolerated alternative to prednisone. The potential of vamorolol administration to address unmet medical needs and provide therapeutic benefits for individuals with Duchenne muscular dystrophy starting from an early age, is remarkable. The final pharmaceutical agent under consideration is exaceronol, a medication that exerts its therapeutic effects through modulation of mineralocorticoid receptors. This drug is indicated for the management of renal disease, a condition that has been associated with the development of cardiovascular pathology. The primary objective of this intervention is to ameliorate albuminuria. Despite the existence of therapeutic interventions, individuals suffering from heart failure and chronic kidney disease continue to face an elevated risk of unfavorable prognosis and progression to end-stage pathology. The utilization of steroidal mineralocorticoid receptor antagonists, for instance, spironolactone and eplerenone, is constrained because of apprehensions concerning plausible hormonal adversities and escalated potassium levels. The discovery of non-steroidal mineralocorticoid receptor antagonists is a significant development in the treatment of cardiovascular and renal disorders. They have been found to effectively target the mineralocorticoid receptor with a notable level of specificity towards this receptor. They observe variations in physiochemical, pharmacodynamic, and pharmacokinetic parameters among these factors are crucial, both in comparison to steroidal mineralocorticoid receptor antagonists and among themselves. The administration of these substances has been noted to result in positive outcomes for the health of the kidneys, cardiovascular system, and blood vessels. Their therapeutic properties have been observed to demonstrate notable anti-inflammatory, anti-remodeling, and anti-fibrotic effects. At present, several clinical trials are being conducted on non-steroidal mineralocorticoid receptor antagonists. As per Pandeado's 2022 findings, the global authorization for medical application has been bestowed solely upon two of the substances that were being evaluated, specifically exaceronol and finerenol. The study during phase 1 aimed to examine the effects of exaceronol on the repolarization of the heart. Researchers utilized a sample of 55 participants who were randomly allocated to one of four conditions, receiving a single dose of either 10 mg, 40 mg, 400 mg of moxifloxacin or placebo. Their findings indicate that there was no significant association between the amount of alcohol ingested and QTc. As per the findings of Mentel et al.'s 2020 study, it was observed that there was a lack of notable unfavorable occurrences of fatalities. In the phase 2 clinical trial, a group of Japanese patients who were diagnosed with type 2 diabetes mellitus was attracted to exaceronol as an adjunctive therapy, along with renin-angiotensin system inhibitors. The study was carried out with the purpose of assessing the effectiveness of the approach. According to the results, a decrease in albuminuria was noted, with a reduction of around 50% depending on the exaceronol dosage administered. The potential of exaceronol to exhibit the mineralocorticoid receptor was observed, which could result in the cessation of albuminuria. According to the current investigation, The intake of a 2.5 milligram extracerebral dose on a daily basis did not result in a significant increase in the likelihood of hyperkalemia compared to the administration of a placebo. There was a marginal decrease observed in the glomerular filtration rate, as per Ito et al.'s 2019 report. The noted phenomenon can be ascribed to modifications in the blood circulation. In phase 3 clinical trial, results indicate that the application of extracerebral for a duration of 52 weeks led to a crucial decrease in albuminuria by over 30%. As supported by statistical analysis, additionally, there was a significant reduction of 76% in the likelihood of progressing to a urinary albumin to creatinine ratio of 300 mg per gram creatinine. According to the results of the meta-analysis, it can be inferred that this specific subject bears important clinical significance. This is because a reduction of 30% in albuminuria is linked with a decreased probability of developing end-stage kidney disease. The data indicates that the administration of extracerebral led to a statistically significant mean reduction of 10% in the estimated glomerular filtration rate. Those findings suggest that the usage of extracerebral was linked with a more significant elevation in serum potassium concentrations in comparison to the placebo cohort. It indicates that the utilization of extracerebral has significant effect in mitigating urinary albumin to creatinine ratio among patients with early-stage diabetic kidney disease. This is the end of my presentation. Thank you everyone for watching, and I hope you have a good day.